I would like to now discuss the different stages that I have found with ladies with breast implant illness. As we previously stated in one of the previous videos, the ladies will get the implants for a myriad of reasons, oftentimes for self-esteem after postpartum breast atrophy or issues or with ptosis or droopiness, breast cancer, all sorts of different things like that. However, the underlying theme is self-esteem, body image. So they get their implants, and what they then find is the next stage is over a period of time, they can start to have some physical decline. And this typically starts with chronic fatigue, where they just don't have the energy they used to have, and they just can't keep up with their children. This then oftentimes will then lead to brain fog and the inability to think clearly or lose words, and this continues from there. We see the other then physical declines that can be physical with loss of hair, hearing, eyesight, rashes, body aches, joint aches, all sorts of things. So this physical decline pursues. And then they can also have mental and emotional and relationship issues as well. Then see their physician, the next stage, trying to figure out what's going on. They search, they get tested, can't find anything. And as we had stated previously, things continue to get worse. However, the next stage is that discovery stage. When they get on the internet or somebody mentions to them, hey, I heard something about breast implants, or they see a news story that talks about breast implants and illness, and then they start to research. And they start to get that ray of hope that they might have found something that might explain everything that has been unexplainable up to that point. Once they find that, then they find a physician that believes, or at least will entertain the idea, that breast implant illness is a real entity, even though we can't fully explain it at this time. There are ongoing studies, and I hope within the next several years we'll be able to explain exactly why this happens. But during that consultation, the physician will share their techniques and give that person, that lady, a little bit more hope. The next stage then is preparation for the surgery. Now, I always look at the surgery as an athletic event. And if we go out and just run the event without training, we can get it done, but we're not going to do as well, higher risk of injury and slower recovery. So at Aspire Plastic Surgery, I have found a protocol in preparation, and it's something I do on a daily basis and have done for years to help build my body, again, as we previously discussed, get those nutrients in, get the toxicities down, let the body begin to heal itself before we go to the major detoxification portion of this, which is removal of the implants and capsules. The next stage is the actual surgery and doing the explantation and the early recovery period within the first 4 to 6 weeks. Where the drains are in, we typically remove those at about a week to 10 days, just depending how much drainage. We actually will give you some special tape and scar gels to help with the scarring to get the very best result that we can. The early then recovery stage after the immediate post-op is usually about 2 to 3 or 4 months, in which the muscles are still healing, you're getting back to activity, we're seeing the body help detoxify, continue with the pre-op protocol, the body begins to build itself. And a lot of ladies start to say within even a few weeks they feel so much better. Now the mid-recovery stage is kind of the mental, emotional, psychological aspect that a lot of ladies don't understand that may and oftentimes occurs. And this is typically between 3 months to 6, 9 months out, in which they're starting to feel better, but when they look in the mirror and look down at their chest, they don't have the volume. They sometimes have more scarring, and they just get back to that same questioning of the self-esteem and the self-confidence. However, the physical health appears to be coming back. It's that mental health that then starts to lag a little bit. And I like to talk to my patients, and then one of my patients actually brought this up to me, that she was not prepared for this. And it really helped me understand how I can better counsel my patients to understand that this is a stage that you will likely go through. Now, having a supportive, significant other is very helpful during this time as well, because what I find is having your health back is far superior than having a nice looking set of breasts. It's great to have nice looking breasts. Again, that's part of my practice, but the health is the number one thing that we're looking for in these patients. Now, the late recovery is about 9 months to 12 months out, and ladies then start to entertain possibly having autologous fat grafting. But at this point in time, almost 100% of my patients that come back say, you know what, I've gone through that mid-recovery, that mental struggle, and now I've accepted my body the way it is. I have my health, I have my family. And most of them say, thank you, but no thank you. I'm fine with the way my breasts look at this time, and they don't do the autologous breast augmentation. Now, the last stage is something that I would like to ask the breast implant illness women, and that's to continue educating and teaching others and sharing your stories, because it will help other ladies that might be struggling. I will also, in that same realm, continue to study and learn and try to figure out what is causing this illness and some of the genetic factors that we have that might help explain this as well, which was covered in a previous video as well.